My name is Harold Oglesby. I'm a respiratory therapist in Savannah, Georgia. And I wanted to talk to you guys just briefly about how we use capnography at our facility. We began using capnography several years ago. Matter of fact, we were one of the first facilities to use capnography in the general patient population. And we did this because of patient safety. We wanted to protect our patients who were receiving opioid therapy via PCA pumps. We all know that one of the side effects from opioids is respiratory depression. We wanted to provide our patients with the safety of having a device that could measure their ventilatory status as well as their oxygenation. They also knew that they were in a patient population in an area that was unfamiliar with capnography. We introduced the Integrated Pulmonary Index, which used multiple parameters to give us one number that could be trended to see if a patient was either improving or deteriorating or staying the same. For the staff member who was unfamiliar with using capnography, this was a win because they could look at one number and knew when they needed to put their hands and do hands-on physical assessment with patients who they thought might be deteriorating. They also could de-escalate therapy if they saw a patient improving. We also wanted to ensure that we weren't creating an environment where we would have white noise and excessive alarms. The Smart Alarm respiratory analysis software aided in decreasing the number of alarms and making sure that we had true alarms. We all know that COVID-19 is prevalent now. Our facility is no different from others. In our facility, we elected to create a COVID area in which we inserted capnography at each bedside. So we put Capnostream 20s at each bedside with remote monitoring using VitalSync. That allowed us to closely monitor our patients and minimize the amount of time and exposure staff members would spend in rooms assessing patients. That didn't mean that they did not assess patients. That meant that they did it smartly. If they saw a patient either getting much better or getting much worse, they could go in and do a physical assessment and decide whether they really needed to de-escalate or escalate the therapy for that particular patient. One of the key ingredients to making sure that our program was successful was having an interface between the device and the patient that was comfortable to the patient and also provided accurate information. To that end, the Microstream sampling line was a wonderful thing for us because it did just that. We also wanted to ensure that we weren't introducing bacteria or cross-contamination into the device. The 0.2 micron filter prevented patients' expiratory vapor and bacteria from entering the device, so it cut out that fear of cross-contamination. Those are the things that led us to believe that capnography was a win-win for us. And currently in our facility, we use capnography throughout. We use it in our emergency room, we use it in our procedure areas, ICU, CCU, and also in our general patient population. And we do it all for patient safety.